Chris and I worked on the most important Lyme disease legislation that's ever been passed at the federal level, part of a larger bill called the, I'm going to get it wrong,
21st Century
Cures Act, which devotes about $9 billion to a number of critical diseases over the next 5 years. But it includes Lyme, which was not going to happen if Chris hadn't gotten action on that, and I was happy to provide and assist on that with folks on our side of the aisle. For anybody here in the Hudson Valley who's dealt with Lyme disease, and that's pretty much everybody knows somebody, everybody's got somebody in their family, you've had it yourself. This will get our act together at the federal level. It will put real resources and a real action plan behind it. It'll get the disease taken seriously for the first time at the federal level. So that's very important. We work on a lot of veteran stuff together. We're working on a bill right now to expand coverage for folks who were exposed to Agent Orange and what they call the Blue Water Navy. Mm-hmm. These are guys who were on ships off the coast of Vietnam, but who didn't actually, didn't have boots on the ground in country, but they were still desalinating water contaminated with Agent Orange. They were cooking in it and bathing in it and drinking it. They had some very serious Agent Orange related health conditions. We're working to extend disability coverage to those vets, and hopefully we'll get that done. There's a number of areas. I mean, in the transportation infrastructure area, on the Farm Bill, Lord knows, we do a whole lot of stuff on the Farm Bill.
In terms of the things that we've worked together on, indeed, that Lyme disease bill is going to be critically important because of the way that we hope it's going to bring real illumination and transparency, that it will bring diverse scientific viewpoints, because the critical issue we're really having is the fact that the guidelines that come out of the Centers for Disease Control are too narrow. We miss diagnosis, we don't have proper treatment protocols, and the insurance companies aren't given the proper coverage to the people who are sick. And when I say to them, how come you're not covering more in this? What they say is, well, if it was approved care, well, then we pay for more of it. Now we're back to the guidelines. This is why this bill is so critically important, because of how we think it'll impact and bring more diverse viewpoints and ultimately change the guidelines. With regard to the Blue Water Navy, Sean mentioned this. This is also constituent driven. I want to make this point, that in the areas that we work together, we're providing a voice for the people of upstate New York, because these ideas are not mine. I'm an author of both those bills, but the author is really the constituents. Sean and I are collaborating to give a voice for our people. On the infrastructure piece of this, so we authored an amendment that addressed the structurally deficient and functionally obsolete bridges. We have a real issue in our state. Our infrastructure is aging, and that's not surprising given the fact that our state was one of the first settled states. But we have so much further to go. What we delivered, our infrastructure bill, increases the federal investment in New York State by 10%. And that's an important investment when you think about the work that needs to be done.